Welcome, prospective adult gerontology acute care NP students. I am Dr. Jennifer Adamski, and I am the program director for the Adult Gero Acute Care NP program here at Emory University. I just want to take a few minutes just to tell you a little bit about myself, a little bit about the program, some of our requirements, and some of the options that you have if you come to Emory. First, I have been an acute care nurse practitioner probably going on 18 years now. I walked out of nursing school back in the day into an ICU and have really never left. I have done critical care and trauma the majority of my career. I currently have a clinical practice. As you can see, I'm here now. I am a critical care nurse practitioner on the critical care flight team for the Cleveland Clinic. So what's really cool about that is it is the first acute care NP managed flight team in the country. So we fly 40 hours on the helicopter each week. I take fixed wing call, which is 24 hours on the Learjet, and we can fly anywhere in the country. And we also do international calls, and I call it critical care in the air. I always tell my students critical care is a type of place, not a unit. So that's what I do in addition to my job at Emory. A little bit about our program. The full-time program is a year long. It's 4 semesters. The part-time program, you have 2 options. You can do it you probably get it done in 2 years, or if you wanted to stretch it out, you could also do it in 3. That's fine. We kind of work around whatever you need. A lot of things we hear is folks wanting to know what our scope of practice is. Now, I do critical care, but that certainly is a very small part of what acute care is. And sometimes I'll tell folks to just get them to understand it a little bit better is any inpatient area inside the 4 walls of a hospital. That is acute care, whether you're talking about critical care, whether you're talking about general surgery, whether you're talking about infectious disease, oncology, endocrine, cardiovascular, all of those things are acute care. And we say in the inpatient areas because typically the emergency room is not an acute care. They may deal with episodic acute processes, but that's not typically our area. Now, what is required for my program? Unfortunately, we do not take AMSNs, and those are the folks that are going right from their bachelor's and have never practiced into a master's program. We do require 1 year of acute care experience, and critical care would be preferred just because you get to see so much. There's very high acuity patients, but it's certainly not necessary. So anywhere, again, in those inpatient areas, whether it be a med surg unit, whether it be a step down unit, whatever you can have in that first year is great. We just need full-time experience. So that comes out to about 2,040 hours of 1 year experience by the time you start the program. So that's just something to think about if you're going to apply for my program. The other great thing about this program is we also have a postmaster's program. And I designed this program several years ago for the primary care nurse practitioner that may be working in acute care. And you will see that some places in the country, and we see it a lot down in Georgia. So I designed this, and it's typically 2 to 3 semesters, 9 to 12 credits. And we get you through and we place you in your clinicals, and there's 2 didactic courses and typically 2 to 3 clinical courses, depending on what your experience is coming into the program. So that's something to think about down the road for those of you that may go back first and get your primary care and come back again and get your acute care. So we do have that option. Sometimes we get the question from students, why don't I just go and become an FNP so I could do everything? Unfortunately, as nurse practitioners, there's not one nurse practitioner that can do everything. So FNPs are in the primary care setting. Outside of the hospital, you will also see them in the emergency room, but that is not, they're not in the acute care areas, or should not be, and does not go in line with their licensure and certification. So that may be a question that you have in your head. But please don't hesitate to reach out to me if you have any more questions. My email is jennifer.adamski, ADAMSKI @emory.edu. I would welcome to hear from any of you. Please don't hesitate to reach out, and hope to see all of you on the acute care side. Thanks again.